My name is Colette, and I'm the Director of Patient Engagement. Um, with Community Health Center of Southeast Kansas, there's so many parts, so many moving pieces that are constantly going. And we just want to sit down today and just have a quick conversation of what that looks like and how we can help, continue to build our relationships and our partnerships with folks just around all of Kansas. Next slide, please. So the first question is, how did we get here? Community Health Center of Southeast Kansas really was born out of the love of our students, our children. We were not giving the vaccines that were needed locally, and our CEO, Krista Postai, realized this, and she was like, what can I do to make sure that our children are ready for school? So born in 2003 out of the partnerships between local school districts, hospitals, and universities, we came together and really worked hard on how can we outreach to those child care centers? How can we go to them? If they're not able to come to us, how can we go to them? And how can we make ourselves more accessible? So that is where we started. And then we have continued to develop services such as nursing that started in 2011. Behavioral health services in schools started in 2015, and community health workers started in 2022. All three really work hand in hand together, which is very unique in itself. I feel that that is one of the ways that we have been able to reach students and really get them ready is because it takes everybody, not just community health, but all of us as a community to make sure that students are ready for school. Next slide, please. So my focus today is just talking about our community health workers in schools. And then Felicia will speak about nursing and Miss Ashley and Ali will speak about behavioral health. But why community health workers? So this is near and dear to me. I know that I'm on a time limit and I could talk about community health workers all day and all the specialties that our teams have brought that have just made such an impact. Um, a community health worker is just like what you see, that puzzle piece. It's like bringing a community health worker to me is like the translator. They're the ones that help between the student, the caregiver, and the faculty members of how and what ways can we bring resources to make sure that they're ready for school. It can be anything from food. We all also know that there's a lot of bed bug issues. There's a lot of other pest control issues that we don't think about that are at the home. So if a child is not sleeping at night, they're not going to be ready to go when it comes the next morning. So it's everything and anything. I always like to say it's not your job, make it ours, because we want the teachers to really focus on what they need to be doing in regards to teaching the student. All those other pieces of clothing, needing clothing, like I said, pest control, all of those pieces is where our community health workers get to stand up and really help find and navigate through the resources. They get to fill that gap that nobody else can really fill because they are so busy with resources. I have to say, the main thing about a community health worker in schools right now, we have 5 community health workers, which I'm super proud of, and that's in 4 districts. We have not only been able to help students, but also, like I said, their caregiver and the faculty. There has been many a time that faculty have come to us and said, hey, I'm having issues myself. I need resources myself. So how can we go ahead and help that faculty member be able to meet their needs so that they can teach better or they can do their job better, which is a reflection again on our children. Um, I do want to mention too, with the community health workers, we believe that there's enough students to go around. There's so many resources in schools. I can't say enough how there are times, and I'm just going to be very, very honest. There are times that they're like, no, these are our kids. We're good. Let's not talk about that community health worker role and where you're coming from. But in truth, it's about all of us as a community. We work with Spark Wheel. We work with the Early Childhood Block Grant. Anybody that is in a specific school, we work with. And on top of that, a community health worker not only needs to understand about the students and the caregiver as well as the faculty, we have to understand the district. So when we first start into a district, it's about how do we develop that relationship that they know that we're in it with all of them. not just here for one purpose and one perfect purpose. It's about all the purposes that need to bring a student to school. I was gonna say, if you guys have any questions, because like I said, I could talk about this all day long. I get pretty excited about it. Just the fact that we have this opportunity to have these things. Thank you, Robert, and Miss Christie for having this. If you have any questions, just please keep those for the end, but definitely write them down. And then I will put my email information in the chat if you have any questions that need to be directed towards me. So I'm going to hand this off to Miss Felicia Hall. She is the Director of Nursing for School Health, and she'll talk to you about her programs.
Hey everyone, like Colette said, my name's Felicia. I'm the Director of School Health Nursing. Been with CHC for over 3 years now. I've been working in strictly school health. Next slide, please. So CHC's mission is to enhance students' academic performance and healthy lifestyle choices by providing medical, dental, behavioral health, and supportive services. So there's so many things that we provide in our schools. Like Ashley, she's going to talk about behavioral health, but we have our outreach team, we have immunizations team. So we have a lot of different resources that we have in our school districts within CHC. Next slide, please. So the school-based health centers, we have a group, and that'll be on the next slide, of our school-based health clinics that we have. So we have the service coordination, medical services that we can provide in our school-based health clinics are acute illness, injury care. We can do well child visits. We can do sports physicals, immunizations, chronic care management, and COVID-19 testing, along with flu, strep, and all those other things that you can do in school-based clinics. We can pretty much do everything that regular clinics can do except for x-rays. That's one thing that we do not have. So they are sent to our main clinics within CHC if they're needing any kind of x-rays. We do telehealth services. That'll be on the next slide of all the schools that we have. And we just started that program this last school year, and it's really blossomed. So we have quite a few, and our staff and our students and everybody really love our telehealth services that we provide. We do mental health services. We do oral health. We do health education and youth development. And then I won't talk a lot about the school-based behavioral health because Ashley Neely will touch base on that. And then our school health services. So we have school nursing, we have dental outreach, medical outreach, state required screenings, immunizations, flu shot clinics, health education training, policy procedure, and records. Next slide, please. Our school-based health centers. So we have 6 school health centers that we have school-based clinics in. We have 13 schools that we have school staff or CHC staff contracted in. So that is our school nurses and our school health assistants. We step foot in 49 different buildings, and that's staff that we have in all of our buildings. So again, school health assistants, nursing. So our 6 school-based clinics that we have are USD 250, 445 in Coffeyville. Our Wyandotte, we strictly do just telehealth for Wyandotte. We do not have a provider that steps foot in there. We do strictly telehealth. USD 257, Iola, and Baxter Springs, and Columbus. We have 7 school districts that we do our telehealth program in, and they are all listed here. I will not have to read them all off to you. But like I said, strictly Wyandotte is who we do telehealth through. And our telehealth services is with our nurse practitioners that are in our school-based clinics. So our providers that we have in there, we have 4 or 5 different ones that we have in there. And so they're a great resource for our clinics. And then we also do nursing from afar and supervision. So for Chautauqua and St. Paul, some of those smaller school districts that can't afford school nurses, they contract with CHC. And so my staff and I have 2 school coordinators that work with me. So we go there, travel there, we do their immunizations and whatever else that they need for school nursing. And then St. Mary's Colgan is a new district that we're doing this year. And then we do nursing supervision for Oswego. So we work with a nurse there, and if there's any resources or anything she needs, we help her out. Next slide, please. So these are just areas of where the school-based health services are within CHC. I will not read all over those with you, but with our outreach team, I know we have 57 different school districts that our outreach teams go to. And again, we can do sports physicals. We can kindergarten enrollment. There's so many different services, immunizations, and all those fun things, and hearing and vision, drug testing, nicotine testing. So there's a lot of different that we do in there. Next slide, please. And who is this all for? This is all for our students, our families, the districts. So far to date, I was actually pulling up our numbers while we were doing this meeting. And so far, we nursing wise have seen 110,000 students. And the month's not even over yet. And that's just for nursing. So that's not for behavioral health. That's not for our community health workers, our outreach teams. That's strictly just for nursing. So we see so many different students and provide so much care for those students and work closely with our community health workers, our behavioral health team, and all those. So really that's what we're here for, is our mission is to take care of our students. And that is it. That is all I have.
I'm Ashley Neely. I'm the Director of School-Based Behavioral Services with Community Health Center. I was actually our first school-based therapist way back in 2015. I was working in clinic as a behavioral health consultant, as therapist working on the medical side of things, helping to get folks connected with the services that they need, or even just providing real-time intervention or emergency services. And Krista Postike came to me and said, Ash, we need you to go to school. They need some help at school and we need you to go. So in February, which is a weird time of the school year for all of you that know, I went February 5th of 2015, was handed a list of 10 kids. And by the end of the short month, I had 30. And by the end of the year, I had 80. And it just continued to grow from there. A couple years later, we were able to acquire some therapists in Labette County. So I got 3 more, and then my helper came the next year in Pittsburgh in the form of Allie Bishop, who was going to join us today, but she's actually she is one of our school-based therapists. She is actually at school today, and one of our little friends needed her support more than we needed her here. So she is tending to that.
I actually was able to join you,
Oh,
Ashley.
there you are. Yay. And then now that brings us to date to where I currently have 14, maybe 15 today, school-based therapists, not including myself. We currently serve 9 districts, and I have like 6 more waiting in the wings as we try to find therapists. Kind of what Angie was talking about earlier, just trying to connect those kids and meet them that didn't have access to mental health services, and be able to get them back in the classroom instead of missing a whole lot of time and stress for parents trying to find a way to get them to appointments, that we can meet them where they're at. And we have the beautiful opportunity to having our offices in the schools. So as part of that, we do a few of our schools are engaged in the MHIT program, and so we are some of those providers that helps on that end of things, which is exciting and continuing to grow. Before I let Allie just kind of give you an idea of what a typical day is like for our school-based therapists, I did see a question, I think, about how we connect together in the community, like with the mental health centers and MHIT and everyone. It takes all of us. There are plenty of kiddos with needs to go around, and we've been very fortunate to be able to work where if we have a therapist in the school, we can provide therapy and then connect with our mental health partners to look at case management or peer support or whatever other needs that the family may have. And that goes with Colette and our community health workers too. They have been a fantastic resource for us as they can meet the needs of, or try to meet the needs of the entire family. So in the beginning, when it was just the few of us, we were trying to manage all of the things. And with the addition and the growth of all of these services and everything our community has to provide, we now have the opportunity to be able to reach out and hand them those and know that they'll be taken care of, and we can get back to doing therapy, which is amazing. One of the cool things about CHC2, and I'm kind of proud of, is like even our food program kind of came from our school-based therapists in expressing the need before spring break about how we worry about our kids and our families not having the food that they need for a week or the resources they need. And so we started putting things in action to try to help with that. And I'm extremely proud of the work that we do, and happy to get kids back in the classroom, happy to help with truancy and behavior and all of the things that our kids face. And I'll let Allie tell you just a little bit about what a typical day is like for a school-based therapist.
I'm Allie Bishop. Thank you for listening to us talk about our wonderful programs. It depends on the school that I'm in. I'm in 2 different schools. As Ashley said, we've grown, through the years that I've been here. This is my 7th school year. And I feel like I've learned to navigate the school system pretty well and fit in where I am needed. I start my day in the drop-off line, greeting students, helping kids get into the building. It's not therapeutic, but it is absolutely relationship building. So that's where I start my day pretty much every day. Unless I have a kiddo in crisis like today. And so I just navigate those waters, whatever the kiddo needs, and to try to find a way to be successful in school today is what I do with them. And that's not just with kids that are on my caseload, so to speak. I try to be supportive of mental health needs in the building that I'm in. Counselors out today, so it's a good thing that I'm here today. Then I typically return to my office and start my schedule for the day. On any given day, I see anywhere from 8 to 13 kids, depending on whether or not I'm running groups. So in our schools, in the elementary schools, we are only able to pull kids during their specials times. So every day is a different day. They're not always going to the same specials. Every Tuesday is not the same. So I do my schedule daily and, rotate through those kids. Just an example, in this school, I have close to, I think it's 56 kids right now on my caseload, just in this one elementary school, and I'm here 3 days a week. So, school bell. I just have to navigate that schedule and get these kids in here. And the thing about having an office in the school is, one, it's pretty amazing because the kids are here and I don't have to rely on somebody else bringing them to me. I can go get them so they don't miss therapy. But also, I can get them in and out and back to class, and they're not missing any time out of their classroom schedule. And that's really important for a lot of our kids who struggle with truancy. I think another benefit to this of being in the schools is that I do get to work with all the different programs. County Mental Health has different programs that come in and out of the school, and I work with a lot of those kids, and we share a lot of families. So I can link them with different services, like through our community support workers or through our school nursing and our clinics. That's another really unique relationship too, is to be able to work with our school nurses. I've already checked in with Cami today for my little friend that had a rough day. She's a school nurse here, just to make sure we have some services on board for her throughout the day. So it's pretty fast, and it'll be 3 o'clock before I blink.